Hello, I'm Dr. Ruth Annan. Today on Spreading Hope, I'm excited to be talking with Allison and Jason Haddad. I'm going to be talking a little bit about their son, Benjamin. Can we start by telling me a little bit about when Benjamin first received his diagnosis? What were some of the things that led you to get him evaluated?
I think we noticed when he was around 2 years old that really something wasn't right with him. Of course, I saw signs earlier than that maybe I suspected. Socially, he didn't really want to play with kids his own age. He wasn't interested. Playing with toys was a difficult thing for him. He was more interested in like the mechanics of everything and spinning wheels and frisbees. And I think when he was at his second birthday, we really realized, I think both of us, that something wasn't right.
Yeah, he was just kind of spending time alone, just spending inappropriate time, if you will, with, you know, flapping books, and spinning wheels, and, you know, it was just kind of sad. I think we both knew there were a couple Saturdays there. I remember just going over to my sister's house, and, you know, all the kids would be playing in the backyard, and he would just kind of be hanging
by
out
himself
in the garage with a toy for, you know, kind of extended periods of time.
Did you decide to seek out an evaluation on your own, or did somebody recommend that to you?
Actually, my pediatrician at the time had mentioned the Center for Human Development. We were originally just concerned with maybe a speech delay, which I think is kind of the starting point for most people when they think something is wrong. So we started with that, doing a speech evaluation, and then actually my speech therapist also recommended maybe having him evaluated. So a couple people had told me about the Center for Human Development. So that's when we decided to call. But he was about 3, so there was a good year in there that we kind of tiptoed around the issue until we were ready to.
You know, and if I could interject too, we also went to a hearing specialist just to have his hearing checked, and he was pretty upset during the hearing test. He kept saying a phrase over and over again, and it was the hearing specialist that wrote us a letter that came in the mail, and she said that he seemed to be echolalic, according to her.
I had never heard the word before.
It's kind of a scary word to hear.
So Googled it, not knowing what it was, and that's when it
all hit.
Because we were like, oh gosh.
You saw a reference to that word.
Autism.
Related to autism,
So we thought, okay. At the time I was pregnant with our second child, so we kind of waited until she was born before we started.
You had a lot on your plate right at that
point
in time.
Absolutely.
Yes. Sure.
So,
wondered if you could tell us a little bit about what you experienced emotionally as you went through that process of having Benjamin diagnosed.
I know for me it was, I mean, it was a roller coaster. Again, like I said, I had just had my daughter.
Right.
And she was 4 weeks old when we came in for our first intake appointment. I think just nervous and scared. I know that's what I felt.
I wanted him to do really well. I wanted him to be beyond the spectrum, like, you know, I didn't want him on this thing no matter what. And it was an emotional roller coaster. You know, I mean, as parents, you go through, you know, a big bout of depression, I think. There's no question about it. And that's what we both experienced. You know, we were depressed. There's no doubt, you know.
Yeah, but definitely when taking him through the evaluation, like wanting him to perform.
Oh, yeah.
And do everything. And so it was interesting to see what he was capable of, like in that kind of a setting, you know, because most 3-year-olds aren't, you know, sitting at a table, you know, doing activities. They're just kind of, especially him, he was wandering.
I think your term emotional roller coaster is probably a very common feeling that many families who've gone through the experience that you have with Benjamin would probably share.
Sure.
Definitely.
I wondered if you could tell me a little bit about the response of some of your family members and friends when you shared Benjamin's diagnosis with them.
I think they were really supportive, you know, just really, really supportive.
Yeah, we were lucky.
Yes.
I mean, sadness, definitely sadness, but as I said, it took us a long time to get to this point, so it wasn't, you know, a huge shock, but as my pediatrician told me, she said, thinking something and knowing it are two totally different things, and when you know it, that's when it hits and that's when it hurts. But we've had an amazing support system.
Absolutely.
From our family that have helped out.
Some families tell me it's when they see that word or that term in writing that it hits home.
Oh, yeah.
Oh, definitely.
Yeah.
Absolutely. I know when we came in and the folder with the word autism on it, and we both just looked at it and thought, you know, and your heart sinks.
Right.
It does. Even though it's not a huge surprise, but it still hurts.
Yeah.
Definitely.
Seeing that word in relation to your son.
Yeah.
Oh, yeah.
Oh, yeah.
No doubt.
What advice could you give to others that might be going through that process of having their child evaluated? What advice would you give to other parents?
I would say, you know, seek support within your family and talk about, you know, what you're going through, and I don't know, just hang in there. As much as it hurts in the beginning, it does get better. You know, it's not the club you want to be in, but it's really not the worst club to join.
Yeah.
And the longer you're here, the better it is. It really is.
So some of the devastation that they might feel at that moment is not going to be the feeling that
No.
they'll
Not
feel
at all.
down the road.
Not at all. No. Time heals all wounds. And
It does.
It'll heal that one.
I think I was at my lowest low after the diagnosis.
Absolutely.
We all were.
Well, you do. You mourn. You absolutely mourn who you thought they were, who they're going to be, and you're just taking a different path. And but you do. You have a broken heart. I remember thinking it felt like my first broken heart. You know, when you're a teenager, and it's devastating, and it hurts physically, and but it does get better. It absolutely does get better.
Lowest lows to highest highs too. I mean, now I mean, we both feel, you know, just so good.
Well, because everything he does is amazing.
It is amazing.
You know?
It is.
We find joy in so many little things.
Even the little things, and the big things.
Oh yeah.
Yeah.
So it sounds like your message to others is really one of hope, that although those emotions right at the time of diagnosis may be overwhelming, that down the road, the intensity of that sense of loss is not going to be there.
No. Absolutely.
That there's a lot to hope for.
Oh,
absolutely.
Wonderful, yeah. And finally, I wanted to ask you, after you received a diagnosis of an autism spectrum disorder for Benjamin, what types of interventions did you seek out for him, and then how did you decide what treatment was best for you and your family?
Well, I think we were lucky having him evaluated at the Center for Human Development, because I talked to a lot of mothers who had their children evaluated, got the diagnosis, and then on your way, you know, and it's, you know, there's a lot of information out there, and it's very overwhelming, and I think we were lucky to be there and to have this wonderful option, you know, of like, you can do this, and it works, and it's wonderful, and so we were really lucky to find the ABA program.
We just knew that it would work too. We knew that it would work for him. It was right. It was close to home for us. We live in Royal Oak. You know,
it's a big sacrifice too. It's a lot
major
of hours.
sacrifice, sure.
But again, like we said, our family was amazing and helped out immensely. But yeah, I think it was the right choice for us. I think, you know, you can take a three-prong approach to therapies for autism. I know that's what I've talked to a lot of people, and it's ABA, and it's play therapy, and biomedical interventions, and that's kind of all we have to grab onto when you get a diagnosis like that. So it's, you kind of dive in and see what works.